A few years ago, after my father had passed away, I wound up having 18 surgeries or procedures in 17 years. Thus, I was in a wheelchair for quite some time. And my weight skyrocketed. I was so isolated. It was like putting me in a box of ticky-tacky and setting me on the shelf. And that's not me. Nothing has worked. Nothing at all has worked. I had gone to my pain specialist, Dr. Linehan, over in Lancaster, Ohio. So when we were talking, Dr. Linehan suggested Prescribe Fit.
I'm Angela Hunter. I am a care coordinator at Prescribe Fit. Diana had a lot of disbelief in herself, thinking she couldn't do it. So as time progressed and she started seeing her weight come down, she's like, I can do this. Yeah, you can.
I've got somebody that calls me and checks on me and how you doing and helps me adjust. I love to cook. I've learned a whole new way of cooking, and I can still enjoy foods that I like, but there's a new way of doing it and cutting things out, drinking more water.
Diana had problems with pain. A lot was because of the things she ate. She ate a lot of foods that caused inflammation. When we changed that in her diet, the pain level decreased so much that she's able to get around more. We started with small walks, just around her office or during commercials. I'd ask them to get up and walk during the commercial, sit back down, get up and down in the chair, something small, so she didn't hurt as much.
They've given me exercises that I physically can do, because this body is not going to get on the floor and it's not going to do jumping jacks. It just isn't going to happen. But the exercises that come through on my phone, and they have the pictures and diagrams of exactly how to move, are working. Since the first of the year until going into June, I have actually lost 33 pounds. I think the worst thing was trying to take a shower. Right now, I can just get up and waddle right into the bathroom and take my shower. It's a world of difference right now. My average previous was around 140 at 68. The last 2 doctor's visits I had was 120 over 64. I am totally and completely floored. I can do things I couldn't do before. I can get up steps. I can walk farther distances because the pressure's not on the knee. The injections we're doing into the spine and the sciatic nerves have gone from about every 4 to 6 weeks. I had to have the spine done in 3 months. I don't ever want to see myself as big as I was in December. There's no way. If I've got about another 125, I'm going to take off. And if you think you're going to stop me, you're wrong.